Good afternoon. My name is Dr. Shanae Bowie-Hussey, and I serve as the Vice President of Health Strategies and Chief Strategic Officer for the Riverside Community Health Foundation. On behalf of our Board of Directors, our volunteers, and our staff, I would like to welcome you to the 2020 Southern California Women's Cancer Conference. Although we cannot meet in person this year, we are excited to welcome you virtually. The mission of the Riverside Community Health Foundation is to improve the health and well-being of our community. And through this conference, it is our hope that you are educated, empowered to advocate, and inspired to thrive from the safety and comfort of your own homes. A little history. In 2006, the Riverside Community Health Foundation gave a seed grant to start an initiative that offered free diagnostic services to uninsured, underinsured, and disadvantaged women who were under 40. Shortly thereafter, a group of breast cancer survivors gathered together to reflect on what would have made their cancer journeys a little easier. From that brainstorm, the Pink Ribbon Place, Riverside's first breast cancer center, was born. Today, the Pink Ribbon Place, which is a program of the Riverside Community Health Foundation, is so proud to continue to be client-driven and to offer cancer support services to individuals and families impacted by all cancers. It doesn't matter the cancer type. Through our Resource Center, you and your loved ones can receive no-cost support services that you need to help navigate you through the cancer journey. This includes individual and family counseling, support groups, education, strength rebuilding classes, client navigation, and products. These products include hats, scarves, wigs, prosthesis, bras, face masks, and hand sanitizer, and much more than that. Think about it. As women, the matriarchs and caretakers of our families and communities, we often take on far more than we should. But we keep going. And sometimes we forget that we need to focus on ourselves and our own well-being. Why? Because many times, even when we're diagnosed with chronic disease, it hurts more for us to see the people that we love suffer than it is to suffer alone and in silence. Well, today is about you. To care for others, we must first care for ourselves, and today is about caring for yourself. Whether you're attending today as someone newly diagnosed, as a long-term survivor, as a support person, or as a professional caretaker, we hope you find what you need to educate yourself, advocate for yourself and your loved ones, and most of all, thrive. Welcome to the 2020 Southern California Women's Cancer Conference.
Hello everyone, my name is Abigail Lopez, and on behalf of Riverside Community Health Foundation, we would like to welcome you to Eating Well During and After Cancer Treatment at this year's virtual SoCal Women's Cancer Conference. It's day 2, so there's still 2 more days and lots of content that you can enjoy. We'll be selecting questions to answer during the Q&A portion of this talk. So please send us your questions via the chat feature throughout the presentation. You don't need to wait until the end of the presentation to send in those questions. So if you're using a laptop or a desktop, the chat box is on your right-hand side. So it should be somewhere around this side, your right-hand side, not my right-hand side, so around this area here. If you would like to interact during the session but would prefer to be anonymous, there is a join the discussion section, which can be found below the live video towards the bottom of the page. But if you're using a cell phone to watch the session, both of the chat box and the join the discussion section could be found directly below the live video. Also, if you like this talk and you're enjoying this talk, let us know by clicking the thumbs up button. If you need support accessing any of the talks on our virtual conference, please email us at terry@rchf.org. So that's Terry, Terri, @rchf.org. It is now my pleasure to introduce you to registered community dietitian from Riverside Community Health Foundation, Sandra Acevedo.
Hi, thank you for having me here today. I'm excited about this presentation I'm going to share with you guys. And I hope it's interesting and very informative for you. Give me 1 second. Let me make sure I do this right. So, okay. All right. So we're here today to talk about the importance of eating well during and after cancer treatment. Once again, my name is Sandra Acevedo. I am the registered dietitian, community dietitian that works with the Riverside Community Health Foundation. And I have done different sessions before for the support group. I have presented here before in the Women's Cancer Conference too. But I'm really excited about this presentation too, because I think it's important for us to discuss how nutrition can be implemented and how it can help us actually during treatment, because a lot of time we talk about it for after treatment or even before cancer ever appears, but we want to focus also today on what could happen during treatment. So let's start with this. Our objectives for today are for the participants to be able to explain the importance of nutrition in cancer care and also prevent cancer reoccurrence. So we'll talk about that. Also for participants to be able to identify ways that they can manage nutritional issues or challenges that can appear, that can happen because of surgery, chemotherapy, radiation, or cancer treatment. So we'll be discussing the different challenges that can appear because of cancer treatment and how they can be made better or improved or managed with different nutritional skills we'll be learning. And also participants will be able to identify holistic options to address cancer treatment side effects. So we'll talk about different options that can also help to manage these side effects, okay? So first we want to talk about the role of nutrition during treatment. As I mentioned in the beginning of this presentation, usually we think about nutrition when it comes to us just keeping ourselves healthy, thinking about healthy aging, all of that. But when we're dealing with a chronic condition like what cancer is, eating right can be very important also during the treatment to improve our prognosis, to improve the ability for our body to heal, to get better, and to receive the treatment in a better way too. And also to help us manage better the side effects that can appear from treatment. So as you can see here in the slide, there's different ways that nutrition can help us. It can help to strengthen our immune system during treatment. We'll talk about those nutrients that are important for that. Improve strength and energy. It can help us manage symptoms and side effects and feel better overall. It can help us reduce bacterial infections, which can get in the way of healing, improve survival and reduce the risk of reoccurrence, as we mentioned, help to reduce loss of lean body mass. So our muscle mass can easily be lost sometimes, depending on what kind of treatments we're doing or if we're not going to be as active. So having the right nutrition can help with that, or also if we're not eating enough. We can improve our quality of life during treatment, and nutrition. Having the right nutrition can also help us reduce complications, infections, ER visits, and improve overall treatment results. So those are the important points we'll be discussing today. So let's start talking about those nutrients that I've been mentioning. First of all, we know protein is important overall for our body. It helps to keep our muscle mass. It helps for growth, repairing tissues, and resisting infections. When the body doesn't get enough protein, what happens is that it starts to break down your muscle mass for fuel. This can make it harder to recover from an illness, or you can have an increased chance of infection because of this. So what happens is that your body depends on protein for your muscle mass, but also for your immune system to keep itself strong and for your body to heal. So if you go through, for example, surgery and your body needs to heal, and it doesn't have enough protein, it's going to go and grab from your muscle mass. So that's why it's important we get a good source of protein. Some good sources of protein are what you can see in this image. You have here your fish, poultry. You can also include lean red meats, although we don't recommend eating them often. We do still can encourage them once in a while when they're lean too. Eggs, low-fat dairy, nuts, nut butters are also good. Peas, lentils, soy foods are also considered rich in protein. So those are all good sources. And just to be aware that people that are dealing with cancer usually will need more protein than what is usually recommended. So being aware of that is important. Finding good sources of protein is important. Okay. Let me go to the next one. So then we have now carbohydrates. Carbohydrates are the body's major source of energy. The best source of carbohydrates are going to be your fruits, vegetables, whole grains, And they're going to provide you with your carbohydrates as food sources, as what you can see in this image, but also with vitamins, minerals, fiber, and phytonutrients. Let me just double. So phytonutrients are plant chemicals that you find in fruits and vegetables very often. And they help us to keep ourselves healthier. They keep the body from developing chronic conditions, and can deter the reoccurrence of chronic conditions too. So when you see that word phytonutrients, they're important specifically also for helping us to prevent cancer reoccurrence. It's better if we get our carbohydrates from those that are rich in fiber, because fiber can help to improve our digestion, can help to improve our cholesterol levels. It can help to keep our gut healthy. Our colon bacteria feeds itself off fiber, so that's another important part, and also helps to reduce inflammation overall in the body. You can also get carbohydrates from sweets. So desserts, candy, drinks with sugar do have carbohydrates. They supply carbohydrate, but very little in the way of vitamins, minerals, or phytonutrients. That's why we don't say go for sweets. We go for the healthier carbohydrate sources, because like whole grain sources, like what you see, oatmeal, brown rice, whole wheat pasta, fruits and vegetables, because they're going to be rich in those vitamins, minerals, fiber, the phytonutrients. Those are all important choices to make. So try to have more of that. Once in a while you can have sweets, but we still encourage you to have more of the healthier options. One thing I want to mention, I know a lot of times you probably have heard that sugar tends to feed cancer. Give me one. Okay. And that's a misconception. What happens is that it is true that cancer cells require more energy because they have an accelerated growth rate. They grow rapidly. However, avoiding sugar doesn't necessarily starve that specific cancer cell. But it is, at the end of the day, it is a good recommendation to have less sweets, because you're not getting the right nutrients from them than if you are having the right types of carbohydrates. So in that sense, overall, for a healthier lifestyle, we are going to encourage you to, if you're going to have sweets, have very little of them, and have them in their more natural form, like from fruits, because you're going to get vitamins and minerals and fiber out of it. The next one we want to talk about is fats. Fats and oils serve as a rich source of energy for the body. The body breaks down fats and uses them to store energy, insulate body tissues, and transport some types of certain vitamins are actually only absorbed through fat too, and they're transported through fat in our body too. That would be your vitamin A, D, E, and K. So there's healthier fats, and there's some that are not as healthy. Let me see. The other thing we can think about when it comes to cancer is that fat can actually help food taste better. So when we're dealing with issues of not being able, our appetite is different, or our taste buds change, fat could be something that we can use actually. Just make sure, as I mentioned, that you choose the healthier fats. So the healthier fats is what you see here in this image. You have here your salmon, your olive oil, your avocado, your nuts, different types of nuts. Those are all very healthy fats to include in your diet. They are known as monounsaturated fats and also polyunsaturated fats. And some of them, as we mentioned, you can see here, you find them in olive oil, canola oil, peanut oil. Your polyunsaturated fats, you find them in corn, flaxseed oils, and seafood. So including those more than the ones that are not as healthy. The ones that are not as healthy are known as saturated fats or trans fat. Your saturated fat mainly come from animal sources like meat and poultry. They come from whole or reduced fat milk, cheese, and butter. Some vegetable oils also have them, like coconut, palm oil too. So a lot of the candies nowadays are actually, the type of fat they're using for them are palm kernel oil. So that's a fat that's also not healthy for us, or palm oil. They can raise our cholesterol levels, increase our risk for heart disease. So because of that, we can have a little bit of it, but we just don't want it to be our main source. Trans fat are also another fat that we want to not include in our diet. Another word for them is hydrogenated vegetable oils or partially hydrogenated vegetable oils. So a lot of companies have removed the trans fat from their foods, but the best way to really know if that happened is by looking at the ingredients and making sure the words hydrogenated vegetable oils are not in there. That's how we know that specific food we're looking at does not have trans fat. And trans fat will raise your bad cholesterol and lower your good cholesterol, and they'll increase inflammation in the body. while these good fats will reduce inflammation and actually help to take care of your heart and overall your body, reduce the inflammation. So that's why fats are going to be important in our diet. Water is very, very important, especially when you're going through treatment. It's vital for our health. If you don't have enough fluids or if you're losing fluids through vomiting or diarrhea, you can become dehydrated very quickly. And if this happens, the fluid and minerals that keep your body working can become dangerously out of balance. So it's important, especially during treatment, that you keep yourself well hydrated. And liquids or water, what's going to keep you hydrated, it doesn't just have to be water. It can include soup, broth, milk, or gelatin. It could be other types of liquids. What I don't recommend to include as a liquid is coffee, because coffee dehydrates you. But other liquids can work as what's going to keep you hydrated. You want to we recommend usually about 8 cups or 8 cups of water, 8 ounce cups, 8 of those a day to keep you well hydrated, so that your body cells get the fluid they need. But if you, as I mentioned earlier, if you're having vomiting or diarrhea, there's a need, you might need extra. So just be aware of that. Our other important nutrients that we want to pay attention to are vitamins and minerals. So vitamins and minerals, usually for a person that's not going through cancer treatment, you can get enough vitamins and minerals from a regular diet. We don't ask you to take extra supplements. It's just specific situations when we ask people to consider actually taking supplements. During cancer treatment, eating a balanced diet sometimes can be challenging, particularly if treatment side effects persist for a long period of time. So if you're dealing with side effects and it's making it hard for you to eat well or eat good, then you want to consider a supplement. Now, no matter what, as we mentioned this is something that you need to discuss with your doctor. We don't want you just choosing any supplement. We want to make sure you talk to your doctor about this first to see what they recommend. Also, vitamins and minerals can help us absorb better the nutrients, the proteins, carbs, and fats. So that's another important part of it. Okay. Let me see. So if your doctor is considering for you to take a supplement, they're going to take into account what side effects you're dealing with. And depending on that, they might tell you if it's okay or not. If you're having limited food intake, it's another reason why they might recommend a supplement. Or vitamin or mineral deficiency are appearing and you're not having enough healthy food, including certain foods, or not eating at all, they most likely might recommend one. So vitamins and minerals are important for growth and development, and they allow the body to use the energy, calories that are in foods. But when we're dealing with cancer, we might consider taking them. A lot of times what I've seen is that some doctors will recommend a multivitamin and also a vitamin D. What I've seen also recommended is to not go over more than 100% of the daily recommended value, the daily value of vitamins. So when you look at your labels and it tells you what's the percentage of vitamins, the percentage daily value, what's recommended, you want to make sure that none of those multivitamins are over 100 if you're going through cancer treatment. I've seen them recommend that. And also what I mentioned is a vitamin D supplement, because vitamin D in a lot of studies has shown to help improve treatment results and reduce risk of cancer reoccurrence. But once again, I'm mentioning all this, but this is something you do need to discuss with your doctor, because the doctor needs to give you an okay about what to take or not to take. And this is also because a lot of times there's situations where people do go and take different types of vitamins and it might not help them during treatment. It can get in the way of chemotherapy. It can get in the way of radiation therapy. And because of that, we don't want to just say, go ahead and take whichever you want. We want you to be careful and talk to your doctor about it and be honest about what you're taking, because they're going to tell you if there's any interaction too. Okay, now we're going to discuss more in detail what are some of the side effects that can appear with cancer treatments and how we can manage them. So some of the side effects that can appear are the ones you see in this slide. We have loss of appetite, can lead to anorexia. This could be from chemotherapy, radiation therapy, depending on where you're receiving the treatment to. That also matters. You can have changes in taste or smell. This can also be from chemotherapy, from targeted therapies. Targeted therapies are when drugs are used to attack cancer cells while minimizing harm to other cells. You can have vomiting, dental gum problems, dry mouth, feeling very tired all the time, which could be another reason why we might not want to eat. Depression, I figure just hearing the word cancer at times for a lot of people is just could lead to having more thoughts related to depression too. So finding that could be, and including depression, sometimes when people are depressed, they either tend to eat more or some people just don't eat at all. Nausea is another symptom, sore mouth or throat, constipation, diarrhea. So we'll be discussing these and seeing what we can do nutritionally to help us manage these side effects better. Let's talk first about nausea. So nausea is a common side effect of chemotherapy and radiation therapy. It may be due to the treatment or to cancer itself also. If you're experiencing it after surgery, you want to make sure you talk to your doctor or your medical team about this as a symptom. What do we recommend? We recommend that you eat your meals slowly, take your time, eat small portions of food frequently. Having some food in your stomach may help you feel better. So don't go too long without eating either, but eating small amounts might help. Try to have low fat, bland and salty foods usually will work best. Avoid greasy, fried and strong spicy food because it could cause you to have more nausea. Cool and clear beverages are usually recommended. You want to drink liquids in between your meals rather than with meals. Slowly drink or sip liquids throughout the day. A straw can also help to deal a little bit better with it. Don't eat your favorite foods when you have nausea, when you feel nauseated. And this is because you don't want to create a dislike for these favorite foods you have. You want to be able to still continue to have this favorite food. So don't eat what's favorite to you when you're not feeling good. Stay quiet after meals. Try to rest while sitting up for about an hour. So don't lay down right away. You want to just rest after eating for a little bit. You can watch television, you can read a magazine, talk with a loved one, or enjoy the company of your pet, or even consider a relaxation exercise. But we just don't recommend for you to go ahead and lie down because it could kind of bring it back up. Do not lie flat for at least 2 hours after eating, we recommend. Keep crackers at your bedside. If you are not getting enough often, or if you get hungry between naps or in the morning, that can also work if you keep them at your bedside. Stay away from strong odors. Having someone else cook, if that is possible, is a good idea. Eat in the dining room or in a room other than the kitchen if you feel that you're very sensitive to the smells. Track your nausea by observing the triggers. You want to pick up on what's causing the nausea. So if you're aware, avoid that so you're not having the nausea more often. And also make sure that you inform your nurse or doctor about the nausea because there's certain medications they can help you with. And there's, I think, a presentation that is going to be in the Women's Cancer Conference specifically about these medications. So just to keep an eye out for that. What are some of the foods that we're okay eating that might not cause us more nausea? It could be oatmeal and cold cereals could work. Soups also are okay. Cold sandwiches. Cold because if we have hot, it might cause us to smell things and the nausea might come back. That's where we're going with cold. Cottage cheese, hard-boiled eggs, plain pasta, rice noodles, mashed potatoes, saltines, as I mentioned earlier, pretzels, canned fruits, applesauce, Jell-O, popsicles, fruit bars, the clear liquids as we mentioned, so soda, juice, or ginger, or mint tea could be okay. Low-fat protein sources like skinned chicken or tofu that is baked or broiled but not fried, that may also help. And peaches or other soft, mild-tasting foods and fruits, not the strong ones. And as I mentioned earlier, clear liquids such as apple and cranberry juice, low-salt broth could work, and carbonated drinks without caffeine. You can do, as I mentioned, teas that are ginger teas, peppermint teas may help, that are either served lukewarm or cold, so not too hot either. So those are some of the foods that we're okay with when we're dealing with nausea. Vomiting. So this is related also to nausea. Vomiting can come from nausea and be brought on by treatment or food odors too. If vomiting is severe or lasts more than a day or two, you want to make sure you contact your doctor because once again, it can make you dehydrated so quickly that you want to be in conversation with your doctor. Here's some tips that we have for you that can help with vomiting. Visualization or relaxation exercise, acupuncture, aromatherapy, hypnosis, and music therapy can all been found to help with people that are dealing with vomiting, also with nausea. Do not eat or drink anything until you have your vomiting under control. We don't recommend you try to eat anything if you're not feeling good and you feel like you're gonna vomit. Try tiny amounts of clear liquid, such as water or bouillon, apple or cranberry juice, fruit ices without fruit pieces, like fruit juice made as ice, ginger ale, 7-Up, plain gelatin desserts, popsicles, sports drinks such as Gatorade, vegetable broth, and teas. Those could all help a little bit, depending on if you actually can drink anything. You want to start with 1 teaspoon every 10 minutes, and you're moving gradually to increase the amount to 1 tablespoon every 20 minutes, and then finalize as 2 tablespoons every 30 minutes as tolerated to get yourself hydrated again once you're feeling a little bit better and you can actually drink liquids. Once these liquids are tolerated, try a softer diet with bland foods. Some bland foods could be mashed potatoes, rice, pureed fruits, smoothies, fruit nectars, yogurts and cereals with milk or soy milk if you like soy milk, or if you're avoiding lactose. And also something else that can help, especially if you're becoming dehydrated, as I mentioned, because of the vomiting, potassium and magnesium rich foods to make you feel better. And these are going to be your electrolytes that we tend to lose when we lose liquids. So potassium, you're going to find them in bananas, potatoes, orange juice, tomatoes, and apricots. Magnesium, you're going to find them in almonds and some different nuts. Chocolate also has magnesium. Just be careful how you handle it if you're dealing with other symptoms. But just to be aware, how do we make sure we hydrate ourselves again? Okay, so that's what we're doing with vomiting. When it comes to constipation, which is another side effect that can appear, chemotherapy, certain medications, or lack of exercise can cause constipation. You want to try to include high fiber foods and this is in regards to helping you deal with it. So include more high fiber foods in your diet. So those would be your kidney beans, your chickpeas. Beans overall are very high in fibers, lentils, fresh fruit and vegetables, dried fruit too can also help. Try to include some fiber in each of your meals. So including that often in your diet is important to keep your digestive system healthy and to avoid constipation. The other thing that you want for constipation that helps a lot is keeping yourself well hydrated. So we'll talk about water in a little bit again, but that's very important with regards to helping you reduce risk of constipation. Start your day eating bran cereals or shredded wheat or foods that are made with whole grains, such as bulgur or wheat berries. You want to aim for a cereal that has at least 5 grams of fiber per serving. Give me 1 second to drink some water. You want to add unprocessed wheat bran to hot cereals and yogurt. You can actually add, they sell fiber supplements that are separated. You can add a little bit, like a teaspoon of that to your cereals in the morning to add, or even drink with a little bit of juice to add extra fiber to your diet. If you're not used to eating a lot of fiber, you want to slowly increase the intake. If you do it too quickly, it can cause a stomach ache and you can get too much gas. So as you may initially have increased gas, flatulence, until your body gets used to eating more fiber overall. So you want to move slowly to including more fiber in your diet. Soak beans in water to help reduce gas at flatulence. And sometimes you might, depending on the beans, you might want to soak them. You soak them in water, you get rid of that water, and then you cook them. You boil them the next day. But you leave them in water overnight, and that getting rid of the water helps to get rid of some of the gas. You can drink, include, like I mentioned, drink plenty of fluids, of liquids, 8 to 10 glasses each day, especially if you're finding that you're having more energy. Make sure you're keeping yourself more hydrated, especially if it's during the summer months when it's so hot out here. Keep yourself well hydrated. Reduce your caffeine intake. I apologize for this. Okay. Your caffeine intake, as I said, caffeine can make you more dehydrated. It makes you get rid of liquids in your body. So we don't want to be drinking a lot of caffeine if we're dealing with constipation. Drink a hot, non-caffeinated beverage upon awakening. This can help stimulate bowel movement in your body. So it helps you go to the bathroom better. And also make sure that you move, add exercise to your daily routine. Check with your doctor first if that's okay. But what exercise does actually helps to stimulate peristalsis, which is the movement of your intestines, that when you have food in them, they're kind of squeezing this, the muscles inside the intestines are squeezing the food through, so it goes all the way to the colon. That movement tends to be more effective, or it happens more often when you're exercising. So that's why I encourage you to be active if possible, if you can manage. If you're dealing with not having a lot of energy, then that's understandable too. Report blood, vomiting, or no stool for 3 days to your doctor. And there is options, as I mentioned earlier, to use over-the-counter fiber supplements. Just talk to your doctor about them, but that could also be an option. Some foods that are suggested when you're dealing with constipation could be whole grain breads and pasta, bran cereals, cooked beans, peas, lentils, legumes of all kinds, raw fruits and vegetables, dried fruit. Prune juice is always recommended, or even just buying the prunes, and hot lemon water also can help. Next is what happens if we're dealing with what's the opposite of constipation, which is diarrhea. Diarrhea can happen from chemotherapy, radiation therapy, chemotherapy, radiation therapy to the lower abdomen, from having malabsorption of certain nutrients, or using antibiotics can also lead to diarrhea sometimes. It can also develop because of intolerance to milk, or difficulty overall if the body's having a difficult time absorbing fats. That could be another reason why diarrhea appears. So if you are experiencing diarrhea, it could also lead to some weight loss, and that could just be water loss too, but you could become dehydrated very quickly, as we mentioned with vomiting, if you're dealing with diarrhea. So you just want to be aware of those symptoms that could be happening. If there is diarrhea, you could become dehydrated, making sure you are in contact with your doctor, and that you find ways that we're going to talk about right now, how to get our nutrients back and our water back in us so we feel better. Okay. So make sure you drink plenty of room temperature liquids to help prevent dehydration. This can include water, teas, Gatorade, ginger ale, peach or apricot or nectar fruit juices, and limit the caffeine beverages. Allow carbonated beverages to lose their fizz, or stir them before you drink them. It helps so that you're not drinking more things that could cause more uncomfortable feelings in your digestive system, or more gas. Consume more potassium-rich foods, as we mentioned before. So those are going to be your orange juice, your potatoes, your tomato juice, your bananas. All of those are potassium-rich foods because it's an important electrolyte that we tend to lose when we're dealing with vomiting or diarrhea. You can try the BRAT diet. BRAT stands for bananas, rice, applesauce, tea, and toast. Try frequent small meals throughout the day. And avoid fried, greasy foods. You can instead have some spicy or highly seasoned food, depending on how well you tolerate them. Cut down on high fiber foods when you're dealing with diarrhea. So this is when you avoid the whole grains, the bran cereals, the vegetables. You go for the white bread, for example, or the regular pasta, not the whole wheat pasta. You can try breads from oat flour or refined flour. Avoid raw vegetables and unpeeled fruits. Resume your consumption of higher fiber foods once the diarrhea has stopped. Avoid dairy if you are lactose intolerant. And use of probiotics can also help when you're dealing with diarrhea too often. There's also L-glutamine or certain digestive enzymes that can help to improve symptoms. This you might want to discuss with your doctor or a dietitian specifically to see what your symptoms are and see if this could help. Okay, so let's talk about some of the foods also that can help a little bit when you're dealing with diarrhea. So we recommend some cream of wheat, oatmeal, and plain rice or corn cereals, canned fruits, nectar, and applesauce. Remember the BRAT diet, we said the bananas, rice, applesauce, and toast can all be good options. White rice, pasta, potatoes without skin, soups without cream, not heavy fat things because they can make it more uncomfortable, eggs, soda and herbal teas, sandwiches on white bread. We said not any high fiber options. So we usually recommend high fiber options to avoid constipation, but when it comes to diarrhea, we avoid it during that time. Cheese and crackers can help, graham crackers and peanut butter, Jello or popsicles. And also if you're not eating, you can try nutritional drinks such as Ensure, Resource, there's Sustacal, Pediasure, and Boost. There's different brands, but you can try those instead, especially if you're not getting enough food in you, as an option to have. And you might be able to have it settle in your stomach a little bit better. And they're usually liquid, so they might help to hydrate you too. Another symptom that can appear because of different cancer treatments can be fatigue. You can see there, this very the image is very common now with everybody working from home. But fatigue is can happen also because of cancer treatments, or because we might not feel like eating. Our taste buds may change. We just don't feel good enough. We might be dealing with depression. Lack of sleep can lead us to fatigue, depression, low blood counts, and certain medicines. So be aware of that too. The medicines you're taking, make sure that you're aware of what the side effects can be that are there to see, because if it is the medicine, then you can also talk to your doctor and see what to do about it. Eat foods that require less chewing, so something easier. Once again, this is when you can try your nutritional supplements. If you're too tired, you want to make sure that the moments that you can eat, you get in something that's nutritious and that's not going to take a lot of energy for you to chew. Get frequent rest, take your time, exercise daily to build stamina if possible, if you can handle exercising. Maintain adequate sleep and nap patterns. You can also consider, once again, this is something you want to discuss with with your dietitian or your doctor. You can consider melatonin for sleeping better, but you want to make sure that's not interfering with treatment. Magnesium glycinate is another supplement that can help with better sleep. So those are things to just discuss, but I'm not saying go home and take them, but discuss it with your doctor or dietitian first. Stay hydrated. Make sure you keep yourself well hydrated. We said we recommend drinking about 8 cups of water a day to keep you well hydrated. Also, massage, relaxation techniques, and yoga have also found to be helpful in helping to manage better fatigue. Some other tips can be to prepare your frozen meals on good days or have easy access food available. So this could be also, if you have a good day where you're not feeling so tired, making a big pot of something. I usually make lentils. I make a big pot of lentils. I'll grab half, serve that for the family, and then the other half goes into the freezer, and I'll take it out the week after, for example. So you can try these different things. You just make a little bit more food so that in the moments when you are dealing with fatigue, you don't have to necessarily go ahead and have to cook on that day. You can ask family members also for help, and that's okay to do that too, because the people are willing to help, especially when we're dealing with these symptoms. Use a crock pot or pressure cooker. There's so many things online right now where they create these bags for the crock pot and the pressure cooker. And they'll tell you, okay, you want to make fettuccine Alfredo and you want to add your vegetables in there. You make everything, you put everything in a bag in kind of like scratch. And then on the day you're going to put in the pressure cooker, everything goes in there and you don't have to worry about making anything. So that could be something where you prepare those things on the days you're feeling okay. Same thing with a pressure cooker. Just some certain things that are frozen, you put it in there and it's cooked in 30 minutes at the most. It doesn't take so long, but they're easy to have ready quickly. And then, as I mentioned, use nutritional supplements as an option also if you're not getting enough food. Our next symptom that can appear when we're dealing with side effects is poor appetite. These can come because of cancer treatment, depression, anxiety, or stress. What do we recommend when we're dealing with this? Make sure you eat 3 small meals and 3 snacks per day. You want to eat by the clock when you're dealing with a poor appetite rather than by your hunger mechanism, because you might not be hungry at all during the day. At 9 a.m., at noon, at 3 and 6 could be a good time. Whatever your daily pattern becomes. Choose high calorie foods at this time, such as you can choose avocados, nuts, seeds, puddings, cooked cereals, dried fruits and vegetables dipped in hummus or prepared with olive oil. Use additional olive oil in salads. So you're good adding these healthy fats right now because you want those extra calories. Snack in between meals. Choose fruit smoothies, high calorie puddings, shakes, high calorie and protein drinks, supplements, sandwiches, avocados. Like once again, avocados are very healthy fat, but it's also high in calories. So it's good to use during these times. And nut butters, nuts, and keep snacks by your bedside. So that when you do have a chance, you just have a little snack and that can help. Plan for special circumstances. For example, if you have to miss or delay a meal for a test or therapy, ask your dietitian, bring a snack or nut of nuts or dried fruit and cheese and crackers. And they usually sell those everywhere pretty much nowadays. So have snacks with you when you're going to specific appointments so that you're not missing your meals. Plan your daily menu in advance. Make a shopping list of your favorite foods and beverages and have that food easily available for you. You may want to portion out snacks and keep them in the refrigerator in Ziploc bags so they're easily available. Request help in preparing your meals. A friend or a relative is very often happy to help out by preparing food for you. That's a lot of ways. That's the way we show love. So it's okay to ask. Some grocery stores have shopping services that can help. That may be accessed through your computer. Nowadays, everything's on the computer. So you have Instacart where you can order food, and they send it to your home, and then that's it. You don't have to go to the store to buy it. Remember that you are very important. So you want to ask for help when it's needed, especially during these times when it is needed. And ideally, before you anticipate that you will need it is also important. So if you're aware that some of these symptoms might appear, talk to your loved ones and be like, just in case, these are the things I might need help with. Fix several portions of your favorite foods and freeze them ahead of time. This can make it easier to decide what to eat when your appetite is poor or you do not feel like cooking. Make food visually appealing. Eye appeal is often the first step in eating. We don't always think of that, but it's important that food looks good. Attractive colors and garnishes such as parsley, lemon wedges, olives, and cherry tomatoes can help enlighten your appetite. So you want to appeal also to your sense of smell too. Herbs are going to be appealing to your sense of smell. Tap into the senses of the well-being that smell can stimulate, such as the smell of fresh bread baking too. If you don't feel like eating, this is what you're thinking about. Like maybe there's options that I can have because they smell better, they look more attractive. How do I make it more attractive for me to want to eat this? Appeal to your senses of smell. Make your mealtime pleasant. Your mealtime atmosphere is very important to encourage eating. Set the table, perhaps adding candle as well as wine. If it's permitted, talk to your doctor first. Whenever possible, eat with a family or friends. Share your meals because you're more likely to want to like sit down and eat and talk. And if you're sharing it with someone, you can try milkshakes or supplements too. And during this time, when you have poor appetite, relax any dietary restrictions. Whatever you've heard about low fat, low carbs, low this, low that. Don't do any of that if you're having poor appetite. We say just eat what you want to eat. Okay? Well, that's what's going to be more important. Another symptom that can appear, sore mouth or difficulty swallowing. Cancer treatment targets fast-growing cancer cells in your body. So these cells in the mouth, digestive tract, and hair are also fast-growing cells. So they also may be affected by cancer treatments. So what do we do when we're dealing with the sore mouth or mouth sores or difficulty swallowing? You want to eat soft foods that are easy to chew and swallow. This could be milkshakes, scrambled eggs, oatmeal, and other cooked cereals. You want to eat foods that are high in protein and calories. Moisten food with gravy, sauces, broth, or yogurt. If you moisten food, it's going to be easier for you to swallow. Stay away from the following foods and drinks that can burn or scratch your throat. So this would be hot foods and spicy foods. Stay away from those. Stay away from acidic foods, from crunchy foods, and drinks with alcohol. You want to cook foods until soft and tender. You might cook food a little bit longer than you used to because you are dealing with difficulty swallowing. Cut food into small pieces. Use a blender or food processor to make food more smooth. You can drink with a straw. Eat 5 to 6 meals every day instead of 3 large meals. Sit upright and bend your head slightly forward when eating or drinking. And stay upright for at least 30 minutes after eating. Like we said earlier before when we're dealing with nausea, don't lay down right away. You want to just stay up and make sure after you eat. Do not use tobacco, do not smoke, and talk to your doctor about tube feeding if you're not eating much. This may happen for people that lose their appetite or they have too much difficulty swallowing. They might have to do tube feeding, and that's an option, but that's something you want to talk to your doctor about too. If you feel that you're not having enough food, and it could be an issue in the long term. Our final symptom is taste change. So taste change, this can also appear because of chemotherapy. The chemotherapy can change taste receptors in the mouth. Radiotherapy or surgery to the head, neck, and mouth area may damage the salivary glands and taste buds of the tongue. So what do we want to eat when we're dealing with this? We want to eat poultry, fish, eggs, and cheese instead of red meat. A lot of times we hear that red meat gives you a metallic taste in your mouth. So that's why we're trying to have other sources of protein. Add spices and sauces to foods if you're not dealing with any kind of mouth sores. So, I mean, you want to add them, but if you don't have mouth sores, if you're dealing with difficulty swallowing or you have mouth sores, this is not something you want to do. Some examples of foods with spices and sauces could be enchiladas, spaghetti, can also be something else. Eat meat with something sweet, combine it with something sweet, such as cranberry sauce, jelly, or applesauce. I know when we used to grill before, we had a fig tree and we would combine our meat with figs and it tasted delicious. Try tart foods and drinks such as yogurt, lemon or orange, or jello or lemonade. Use sugar-free lemon drops, gums, or mints. If there's a metallic, use this if there's a metallic or bitter taste that stays in your mouth. Try to eat your favorite foods if you're not nauseated. Like I mentioned earlier, if you're not feeling good, don't choose your favorite foods. But if you're feeling good, you can go ahead and eat your favorite foods. Use plastic utensils and do not drink directly from metal containers if the food have metal taste. So try to avoid metal if you're dealing with food that's causing you metal taste. Try to eat your favorite foods if you're not feeling nauseated, as I said. Okay, chew food longer to allow more contact with taste buds. If food tastes dull, if food tastes dull but not unpleasant. So try to take a little bit longer when you're eating your food. Keep foods and drinks covered. Drink through a straw. Turn a kitchen fan on when cooking or cook outdoors if smell is bothering you. And then make sure you brush your teeth and take care of your mouth and visit your dentist for checkups for sure. Sometimes cancer treatment can cause temporary changes, as we mentioned. So being aware of this, we want to try these different tips to help us deal with these taste changes that might appear. Okay, final part, I'm gonna go a little bit quicker in this part, is I'm giving you guys a little bit of information with regards to what do we need to do to help us when it comes to nutrition to help us prevent cancer reoccurrence. So in the first year, you may still be dealing with symptoms from treatments, like nausea, changes in appetite, difficulty swallowing, or fatigue. You want to continue to treat the symptoms first to improve nutritional status. Our focus is first, let's deal with the symptoms, let's deal with the healthy nutrition, everything afterward. First the symptoms, because we want you to have a good quality of life. Once your symptoms have improved and you can tolerate most foods, we then start shifting towards the health promotion and cancer prevention information that we know. And recommendations for survivors are the same as those for cancer prevention overall. So that's what we're going to discuss right now. Anyone who has received a diagnosis of cancer should receive special nutritional advice from an appropriate trained professional. Ideally, you want to have been referred to a dietitian. Once treatment has been completed, if you're able to do so, you want to aim to follow what is known as the American Institute of Cancer Research, their cancer prevention recommendations for diet, physical activity, and healthy weight maintenance. These recommendations are well studied and they have shown to help reduce risk of cancer reoccurrence. So first of all, we have tried to be at a healthy weight overall. Without going into the healthy, even a little bit of overweight, just don't go underweight or obese, because then we increase our chances of having cancer reoccurrence. Next to not smoking, a healthy weight is the most important thing you can do to reduce your risk of cancer. Aim to be a lower end of a healthy body mass index. Excess body fat can act as a hormone pump, releasing insulin, estrogen, and other hormones into the bloodstream, which can stimulate cancer growth. So next slide, this slide is showing us our BMI. Your doctor, usually when you go to the doctor, they take into account what your BMI is. Your body mass index is a person's weight in kilograms divided by the square of height in meters. Ideally, we should all know our BMI or where we're at. It's an inexpensive and easy screening method for weight categories. And there we see underweight, normal weight, overweight, obese, and clinically obese. Ideally, we want to be in the area of normal weight, not go underweight either. And if you're going a little bit overweight, it's okay too, but just staying more in the normal range is more important with regards to cancer prevention. Next, we want to make sure we're physically active for at least 30 minutes every day. Studies show that regular activity can help to keep your hormone levels in check. For best health benefits, 60 minutes or more of moderate activity every day, or 30 minutes or more of vigorous activity. So seeing what accommodates you. You do not need to go and do 60 minutes all at once if you're not exercising. Start with 15 minutes, 10 minutes if possible a day, and you slowly increase it. Physical activity of any kind can help reduce cancer risk. Studies have shown that regular activity can help to keep hormone levels in check, which is important because having high levels of certain hormones can increase your cancer risk. So that's what physical activity is doing to help us reduce our risk of cancer. Next is making sure you limit your consumption of sugary drinks, limit consumption of energy-dense food. You want food that is rich in nutrients, not calories. So here, if we choose healthy food, we're going to reach a healthier weight. And that means that, as you can see from this image, we reduce our risk of cancer. So our energy-dense food are going to be what you see in this image. Our nutrient-rich foods are going to be your vegetables, your fruits, your beans. And they're not considered energy-dense. They're full of fiber, water, and they can help you fill up without having extra calories. Regular consumption, consuming sugary drinks can lead to weight gain. Best substitute for that could be your water, teas, sometimes coffee too, just not a lot because it dehydrates you. Keep fruit juices, even natural ones, to no more than a half a cup a day, because it also has a lot of sugar that can make us increase our weight. As you can see here, also this shows you a little bit about energy-dense food. Here you have 400 calories on the left side of oil, 400 calories of chicken, and 400 calories of vegetable. So you can see that your vegetables and fruits are not going to be energy dense because you can have a lot more of it. And that can help us reach a healthier weight. Eat more a variety of vegetables and fruits and whole grains and legumes. Plant foods contain fiber and other nutrients that can help reduce cancer risk, and they can help us reach a healthier weight. And the American Institute for Cancer Research recommends that we base most of our meal with, when you're looking at your plate, 2/3 of your plate should be plant foods. They contain vitamins, minerals, also phytochemicals, as I mentioned, and phytochemical compounds they're compounds that protect the cells in our body against damage that can lead to cancer. Limit consumption of red meats and avoid processed meats. So this is what you want to, especially salty meats too, you want to avoid those. Those are not healthy for us. They can increase our chance of cancer overall. So with regards to moderate amounts, usually they recommend, the American Institute for Cancer Research is saying 18 ounces per week. I would say usually what you're looking at the palm of your hand, once a week should be okay, which is about 3 to 4 ounces once a week, just to be cautious with regards to red meat, and try to incorporate other sources of proteins because they're going to be healthier. Limit alcohol drinks. Ideally, as you can see here in this image, for cancer prevention, any alcohol in any form is a carcinogen. So even though we hear that drinking wine is great for our heart, when it comes to just thinking about cancer, any alcohol is a carcinogen. Now, realistically, sometimes we are going to have a drink. So what is the recommended amount we can have? For men is 2 drinks at the maximum, and 1 for women a day. So you can see here what a drink portion looks like. You have here a beer, size beer, a 12 ounce. You have wine here, about a 5 fluid ounce table wine in the cup, different types of wine, liqueur, or even alcohol shot, like the tequila shots, one of those, and that's it. So being aware of that is important. Limit consumption of salty foods and foods high in sodium. Salt and salt preserved foods probably increase chance of developing stomach cancer. So, and that's what I'm careful about too, because a lot of times when we eat out, there's a very high amount of salt being used in that food. That's why it's so much healthier to cook at home. And one of the other reasons, we're not aware of how much salt is being put into the food we eat or what we're ordering. So being once in a while is okay, but just being cautious about having fresh foods is going to be better because we're not going to have that amount of salt. High salt intake can damage the lining of your stomach in ways that can lead to cancer. So you want to limit packaged and processed foods, eat more fresh foods, cook more often at home, and read labels. You want to not have no more than 2,300 milligrams of sodium a day. So easily, if you look at the cup of noodles, those cup of noodles, they range about 1 serving of those. I would say last time I saw one, I think it was close to 1,800 milligrams. So they're not reaching the 2,300 milligrams, but that's just one serving of something in the day. So that's why it's better if you're cooking at home, if it is possible, or making sure that wherever you're buying your food, hopefully you're getting salads with it or things that are fresh, because you know there's not a high amount of salt being added to it and it's not so processed. Next is do not rely on supplements to protect against cancer. So that's where we don't want, if you need a multivitamin, as we mentioned earlier, you want to talk to your doctor about it. If there's an assumption that, or if you're not eating enough, there's a poor appetite, your doctor may consider it. But don't use supplements to say this is what's going to keep me from developing cancer or having cancer come back. The best source of nourishment is food and drinks, not dietary supplements. It's always best to discuss your dietary supplement options or choices that you're making with your doctor or registered dietitian. The American Institute for Cancer Research expert panel found strong evidence that high dose supplements of some nutrients can actually affect risk of cancer in different ways. So what tends to happen is that sometimes they found that certain supplements, for example, vitamin A, beta carotene, supplements can increase risk of lung cancer in smokers. Increase risk, not reduce risk. Supplements can interfere or interact with chemotherapy sometimes. So that's why it's so important. Don't just take any supplements, especially when you're going through treatment. Talk to your doctor, see if if you do feel like you can take a multivitamin, if there's one needed, and talking to them and making sure that the vitamins on the side are no more than 100% of the daily value of what's recommended. But still talk to your doctor about it, because I don't want you guys taking any supplements without discussing this first, because it can, they found out it can interfere with some treatments in cancer and maybe not make the treatment as effective as it should be. Next is for new mothers. We recommend breastfeed your babies exclusively for up to 6 months. Breastfeeding benefits both the mother and the child. The evidence that breastfeeding protects mother against breast cancer is very convincing. Breastfeeding lowers the level of some cancer-related hormones in the mother's body. And at the end of breastfeeding, the body gets rid of any cells in the breast that may have DNA damage. So the body's amazing, and it does that. Babies who are also breastfed are less likely to become overweight and obese as adults. Overweight and obese children tend to remain overweight in adult life. And this is a risk with regards to cancer, as what we mentioned in the first part of this. Being overweight or being in the risk of obese can increase your chances of cancer. If you're planning to breastfeed your baby, your doctor or a certified lactation consultant can help with this and provide more support. Balance your plate. I talked a little bit about this. We want 2/3 of your plate to be fruits and vegetables, as you can see here in this image. 1/4 is going to be your whole grains, your whole brown rice, whole wheat pasta, quinoa, if you want to use quinoa. You have here 1/4 is going to be your lean proteins, making sure you choose proteins that are low in fat. So remove the skin of the chicken ideally, and you eat what's left there. Okay, so that is my final slide. Thank you so much for being present today for this presentation, and I'm here ready for any questions.
Okay. Hi, sorry. Thank you so much, Sandra, for sharing your insight and knowledge about nutrition during and after cancer treatment. So it's now time for the Q&A questions from our audience. And the first question is, how can caregivers support a loved one who doesn't want to eat or is unable to eat?
So we would see how long it is for, but a loved one who's not able to eat or doesn't want to eat, so poor appetite. So when we were talking about poor appetite today, what I would recommend is having the food the person likes is important. Having that around, not putting any restrictions with regards to what that person should be eating, like leaving it open. Another way is coming to an agreement with them. If they don't want to eat at all, I mean, it depends on what they're dealing with, but I would say if they're not eating at all, I would go with supplements. I would consider Ensure as a supplement to just make sure the person's getting something. I would also get them involved in the process of choosing what they want, or saying, look, I have these options. I want to make you these different foods. What do you think I should add? Or you might know better what tastes better, things like that. So it kind of has to do a little bit with what the symptoms are. But I think it's them involving them in it. I'm not muted, right? I just wanted to check. I'm not, okay. Sorry. Involving them in the process, if possible, might make them more likely to want to eat too. But if you see the person not eating for some time, if it's going for, if it's often and they're losing weight quickly, I would talk to their doctor as soon as possible. Because a person that's going through treatment and if they're not eating, they can become malnourished quickly. They can lose their muscle mass quickly. That's called sarcopenia, and that could put them at risk of other complications and maybe even their treatment not working as effectively. So I think be in contact with the doctor and find ways to involve them, and get what they like. And they want ice cream, just it's okay if they have ice cream. Please give them ice cream. Give them what they like, if they're not eating.
Thank you. Thank you so much. So next question. I know you mentioned on your presentation that coffee does make you dehydrated. But do you know if there's any, the coffee does affect cancer risk in any way?
So coffee has been found. Coffee is amazing. I'm not a big coffee drinker, but it's amazing because they're always finding new studies with it. Oh, it's good for you. It's not good for you. Lately, based on the American Cancer Institute for Research, actually, they say that coffee consumption in moderation helps to reduce cancer risk. So it's where we have it under a good panel right now. I don't want to say tomorrow they might come up with something else, but right now they have actually for some time have said that it can, with regards to cancer, it can help reduce risk in moderation.
That's a key word, moderation, definitely. Thank you. So the next question is more around the concept of information. So right now with the internet, it's literally endless. We can Google something and we get so much information, which could be very overwhelming. So the question is, do you have any tips for someone trying to find reliable information? Because I know you can look at one page, it says one thing, look at another page and it says total.
Yeah, so I do understand how hard it is because there's a lot out there. So my information, what I presented today, a lot of what I gather also comes from the American Institute for Cancer Research. And what I like about them is that they're looking at research in cancer, what's happening all over the world. And they're looking at the different studies taking place, and they're seeing which of these studies are effective, which ones have the right amount of people to show that there's any type of relationship, to show controls, to compare, contrast, everything. And because of that, when they do give you recommendations like what we talked about today, they're actually very well studied recommendations. And they're able to say that with like, this is convincing information, like what we said about breastfeeding. So the American Institute for Cancer Research is one. Now, government, I think government organizations like the CDC will give you good information too. They're keeping things up to knowledge, and they're not going to post something that if they don't have good knowledge about, they're going to make sure about that. So government ones, a lot of the educational ones, different universities have websites that have information with regards to cancer. San Francisco has one, Harvard has one. Harvard has a great one. I'm trying to think of different ones, but the educational ones are also good. Now, if you're looking at blogs, they're more of their opinions. So how I'd be wary about that, I would first see who is the blogger. What is their background? Did they study? Did they go to school with regards to what you want to find out about? You want to make sure that the person is certified, has their degrees in what you're looking for, the information you're looking for. I think that's important. And then also be aware, because this is what the news does a lot. They'll put out there something so it causes emotional reaction out of you. Like say coffee is the wonder miracle of everything right now. And they might say something like that and you get excited. Like when you notice that you're reading something and you get emotional about it, you there want to just step back and be like, let me see how this is presented and what they're trying to get out of me. So I feel like when things are being presented in that way, you want to be a little bit more cautious. With I'm not saying no bloggers are not good. I think there's some that are great. Some of the things they have out there. Just make sure you look at their certifications, and also they a lot of times say this is where I'm getting my information from. If they're not, then that's giving you another clue to that maybe you don't want to follow that.
Thank you. That's awesome. Next question is, when is the best time during your cancer journey to reevaluate your diet?
To reevaluate your diet?
Mhm.
Okay. So that's a really good question. All the questions have been really good, but I'm enjoying this one because it's so related to what we talked about today. When you're going through treatment, I recommend you prioritize your quality of life during treatment, because there's side effects that can appear during treatment that might make it difficult for you to eat. I would never tell you, hey, you just got to start eating broccoli, because broccoli is great for you, especially if you can't swallow and you're having difficulty swallow. So during treatment, you first at that time deal with those side effects that might appear. And if it means that you might not be eating as healthy, that's okay. You're trying to find ways to manage those side effects better. So that's one type of diet we might be following there. A year after treatment, you're still going to be paying attention if there's any of those side effects left. Are you still dealing with metal? Do you still taste metal when you taste red meat? Is that still pleasant there, or when you should you use your regular utensils? So in that year after treatment, you're still going to be kind of paying attention to the side effects and kind of going back and forth and being like, if I'm doing better and I can tolerate most foods, then I go back and say, okay, what are the steps you need to follow to make sure you're eating in a healthy way? And that's when we go back, what I showed you guys in the last presentation, the plate. You want to start eating that way, where it's most of our diet, we want it to be plant-based. We still can include, I'm not, plant-based doesn't mean don't include animal protein. I'm not saying that. You can include it, but you want your majority of your meals to be, the 2/3 of it, be coming from plants.
Thank you. So actually that concludes our Q&A. So thank you so much again, Sandra, for answering all the questions and for the incredible information that you shared. And of course, to our audience, thank you all for joining us today. Please feel free to check out the on-demand sessions, the Author's Corner, the resources, and survivor testimonials via the links above. This talk will be added to the on-demand session as well, so you can watch it again, and please share it with your friends and family. If you want to know more about the Pink Ribbon Place and the services that are provided at no cost, please be sure to follow us on our Facebook and our Instagram, both at the Pink Ribbon Place, or visit our website at pink.rchf.org. At the end of the conference, watch out for a survey email where you can let us know how we did and also get an opportunity to win some fabulous prizes. Our next live session will be the impact of cancer diagnosis on relationships and tips to help promote healthy connection and communication. And that will be available tomorrow live as well at 3 p.m. To watch that talk or see what's coming up next, visit the schedule link above. Again, thank you so much and bye.
Thank you.